Welcome back to Beauty and the Wise, the ultimate lifestyle and wellness podcast where we redefine what it means to age well inside and out by creating a space for women to learn about their bodies, their hormones, and their overall well-being with clarity and confidence. I'm your host, Kisha Tyrrell, and today we're having a conversation that is deeply important for every woman, no matter where she is on her hormonal journey. When we talk about perimenopause and menopause, we often focus on symptoms like hot flashes, sleep changes, mood shifts, or weight gain. But there's another layer of women's health that deserves just as much attention: the connection between hormone changes and cancer risk, prevention, and long-term health. And that's why I am so grateful to be joined today by Azuree Williams, Education Officer at Bermuda Cancer and Health Center. Azuree plays a crucial role in helping our community understand cancer awareness, early detection, and what women need to know as their hormones shift in midlife. Today, we're going to talk about prevention, screening, recovery, and the emotional side of investigating cancer. Whether you're managing risks, supporting someone you love, or recovering and rebuilding life after treatment. This is a powerful conversation and one that every woman needs to hear. So let's get into it. Welcome, Azuree. Thank you for joining us.
Thank you, Kisha.
So why don't we start by you giving us a bit of background and telling us about your role as Education Officer at Bermuda Cancer and Health Center.
Well, I've been at Bermuda Cancer and Health Center for the past 11 and a half, almost 12 years, so over a decade. I have been an educator for over 30 years, my own tutoring service, homeschooling. It's something I'm very passionate about. And at the center, I am the main lead for education, delivering all the programs that we offer, and just getting our messaging out there and aligning with our mission, basically.
Okay, thank you. So let's start by just putting these into context. So for women going through perimenopause and menopause, what are some key things that we should be, understanding when it comes to the relationship between hormones and cancer risk?
Well, first and foremost, hormones does not equal cancer. So we don't want women to think, okay, well, I'm loaded down with estrogen or I'm low on estrogen. Either way, it does not equate to having a cancer diagnosis or being at risk. However, during peri and menopause, we know that estrogen and progesterone, the levels go down. And then when you are post-menopausal, the levels can go up. And when you're storing fat, especially in your abdominal area, you're going to hold more estrogen because estrogen loves storing itself in fat, unfortunately, which is why women who are overweight during menopause have a higher risk as well. So really just being your own best advocate, having conversations with your doctor, saying, hey, I need you to test my hormone levels. Am I going through peri? Am I going through menopause? Just asking the questions and getting answers and getting on your way to, I guess, being comfortable in your body and the journey that you're going through.
Yes, absolutely. So at what age or stage should women be paying closer attention, especially when it comes to screening, or what are things or screenings that they should not skip? Like, what should they be paying attention to?
Well, it really depends. Every woman's body is different. Yes, if you're a female, that alone puts you at risk for breast cancer and other female cancers like ovarian, cervical, and even colon cancer. It's male and female, but it's still second most common in women. And when we look at what risk factors are and things that women should be considering, it's important to get screened starting at age 40 because that's when your risk starts to increase. The older we get, the more our risk. And typically around 40s is when we see women entering perimenopause. Sometimes menopause may happen early. If it's an early induced menopause, unfortunately for some of those women, you really need to have conversations with your doctor. They will recommend mammograms at age 40. If you have a very strong family history, you may have to start before the age of 40. However, mammograms are not the end-all be-all. There are options. We have mammography, we have ultrasound, we have MRIs. It's important for women to have conversations with their doctors. Some women may have certain risk factors, which a mammogram may not be ideal, but it is the gold standard. That's what most doctors will recommend, most radiologists and breast specialists. So it's, again, having those conversations, knowing, asking your doctor, look, do I have a family history? If I do, I need you to test me. Let's have genetics testing. And then they'll get screened for colon cancer around the age of 45. Generally, it starts. But again, if you have a strong family history, it's before. And when they're screening for cervical cancer, that involves the PAP and HPV DNA test. And that typically happens in a woman's 20s. Okay. So it's lots of things that we as women have to take into consideration when we're screening, but it really depends on your family health history, your medical history, and having those conversations with your doctor.
So can you go a bit further, because you mentioned genetic risk? Can you explain the difference between genetic risk and lifestyle risk, and what's the role in prevention in that regard?
Well, genetics means that you have certain genes that are cancer genes that are passed on through generations, through your bloodline. And when we look at breast cancer in particular, there are 12 breast cancer genes. BRCA1 and BRCA2 are the most common. However, 85 to 90% of women who are diagnosed with breast cancer are the first in their family. It's not necessarily a family history. More like 5 to 10% of cases are genetic when it comes to cancer. A lot of it is lifestyle. So when we look at lifestyle, it comes down to, what are you eating? Are you exercising? Are you moving on a regular basis? Are you overweight? Obesity is so prevalent in Bermuda. 75% of our population is either obese or overweight. That plays a huge role in cancer diagnosis in general. We are seeing more cases with people who are overweight or obese. And when it comes to women and breast cancer, it's a very strong correlation. So we have to really be mindful of that. When it comes to lifestyle, look at what you're consuming, look at your movement, exercising, walking is free, get out there and walk. Just going for regular screenings and checkups, managing your stress, getting enough rest. I mean, it's simple lifestyle changes that can impact cancer diagnosis.
And then add perimenopause or menopause to the mix. And
yeah. It's a lot. It's a lot. Being a woman can be a lot, but again, I can't stress how important it is to be our own best advocate and stand up for yourself. Take your health seriously, go and get checked. Any signs, symptoms, there are so many things that we may take for granted and brush off that could be something serious. And if we get ahead of it, the better chances of survival and healing increase. So, yeah.
You mentioned stress. I mean, that's a silent factor and a biggie. But can you speak about chronic stress, hormones, cancer, like the connection?
So stress doesn't necessarily cause cancer, but stress causes many other bodily dysfunctions. Yes. So stress can cause inflammation. So stress can disrupt your sleep cycles, your eating habits. We have stress eating. And then you eat foods that are GMO foods or processed foods, genetically modified foods. Putting things into our bodies such as sugary drinks. Nutrition plays an important role when it comes to having a healthy lifestyle or living a healthy life. And we really need to take into consideration those things, and knowing that stress, if it causes inflammation, it can impact your perimenopause or your menopausal journey if you're not mindful of what you're consuming, and if you're resting and just letting things go and putting yourself first. Yeah. It's very hard for us as women. No offense to the men out there, but it's very hard when you're a mom, you have a career, you have your extended family, like parents who we're caregivers for. It's it's a lot that we take on as the nurturers. And with that, naturally can come stress. And we really have to be mindful of how well we manage it and seeking the resources that are out there to help us with that.
And speaking of resources, does Bermuda Cancer and Health offer, any help? Any sort of programs or prevention steps that we can take that you offer?
Well, I mean, we primarily offer the free education programs, which I'm responsible for. So we have the Know Your Lemons program, which is a breast health program, and these are all free. We have a Reduce Your Risk presentation, which is looking at the 5 top cancers locally and globally and what are the prevention measures. We also have the Lung Smart program, which focuses on the dangers of smoking and vaping, because vaping is on the rise amongst young people. We're going to see more and more cancer cases coming out of that. Research is definitely going toward that direction. Smoking is a major contributing factor. It's the leading cause of preventable death in the world. The number 1 cause of lung cancer. We have women who have been diagnosed with secondhand, they've been exposed to secondhand smoke, and we've seen an increase in lung cancer globally because of that. They're a non-smoker, but exposed to the secondhand smoke from living with a partner who smokes. So we cover so much information in our free education programs. We have the Sun Smart, and that's about skin cancer and prevention. And then we do have our cancer patient navigators who are on board at our center. We have 2 currently, and anyone who's diagnosed with cancer, they automatically, if they're sent to us as a patient, they go through the navigation system with our navigators, and it's basically guiding people in the patient pathway. So they have guidance from start to finish, and they know what to expect. All of this is broken down if someone does receive a cancer diagnosis and they're sent to us. As far as support groups, it's not something that we provide to the community, but we do have resources that we, send people toward, and this is the direction you need to go. We have the breast cancer group, Just Beyond Recovery, and Just Between Us. They used to meet with us at our center regularly, but they still are out there in the community assisting women who are being diagnosed with breast cancer. We encourage people to be in touch with the prostate awareness group, because they focus on prostate awareness for men, the Daily Mail. There are so many other organizations that provide support that we definitely guide our patients into the hands of those who are already doing the work.
Yeah. Okay. So let's talk about women who are potentially recovering from cancer. What sort of hormonal challenges do they face, especially after treatment? Can you give us any insight on that?
It can be tough. I mean, fortunately and unfortunately, cancer is not going anywhere. The global burden, the local burden is real. Unfortunately, it's not going anywhere anytime soon. And the unfortunate part is that in my role, I get to interact and meet so many people who are going through or have gone through the cancer journey. And some of the stories are extremely emotional. And fortunately, though, I make wonderful connections with these women who I say they're gladiators, they're warriors, and some have to have breasts removed and they have to have reconstructive surgery. And sometimes it's difficult. You don't feel comfortable in your own skin. You don't feel comfortable with your partner. You don't want to go out in public. But then you have some women who are determined to continue to live their best life. They go through reconstructive surgery. Some women opt out and say, you know what, I'm fine as I am. So it's really taking time for yourself, reaching out, sharing your story, networking with other survivors, getting more information, allowing them to share their journey with you that can inspire you, that can motivate you, and know that it's one step at a time. Don't beat up on yourself. Be gentle, be kind with yourself, and try your best to seek help if you feel like you're struggling and having a hard time. Not everybody can walk it with their head high. Some people have a really tough time with the treatment. And that's why it's important to speak to your doctor, ask what are the resources, what support can I find on island that I may need to help me get through this journey. It's a healing process. It's not going to be all in one day. It's not a one-time appointment. This is a journey that you have to take one step at a time.
Okay.
Yeah.
Thank you for that. You mentioned about treatments, but so do survivors experience treatment-induced menopause? Like, is that one of the things?
Yeah.
So shaking your head.
Yes. It can happen. It's not always the same or a guarantee. You just never know because, you know, this is biology we're dealing with. You can't always say this is guaranteed it's going to happen or it's not going to happen. Sometimes a patient they wouldn't even know that they're going through it because they may not have been told, or they may just think this is normal stuff. Like you mentioned in the beginning about hot flashes and fatigue, mood swings, all of this stuff can occur from treatment. Like if it's treatment induced menopause, it's definitely something as soon as the patient notices these signs, new things that are happening with their body, they really need to have a conversation with their doctor so that they can know what are their options as far as helping them through those side effects. Yeah.
And are there any specific follow-up screenings for women in that particular situation?
Definitely, most cancer patients, if not all, will have to go for follow-up blood work. Sometimes it's every 4 months, every 6 months. It really depends. It's individualized, and survivors will have individualized care. It's not a one-stop shop for everyone. Sometimes it's going to be different. You have typically blood work and scans like CT scans or MRIs, where your doctor is going to monitor and surveil, making sure that there are no changes and things are improving or at the least stabilized. So again, it's important for patients to ask as many questions. When you have your follow-ups, take a friend, write notes. Some people feel very intimidated or uncomfortable and may think, okay, I don't want to ask a silly question or too many questions. There's no silly question. There's no such thing as too many questions when it comes to your health.
Yes.
Putting yourself first. If you have as many questions as possible, ask away. And if your doctor can't answer your questions, you have the option to go for a second opinion, and don't be afraid to do that.
Okay.
Yeah.
Thank you. One topic that seems to always be in the cancer space, hormone therapy treatments. Obviously, you know, again, we're talking about cancer, just in general, a view on HRT, and especially also give us a view on women who have recovered from cancer. Do they even have the option to go on HRT?
HRT is always an option. However, women need to know what their risks are, because there are some hormone replacement therapies that can cause cancer, specifically breast cancer. It's important to ask questions. What are my risk factors? What are the side effects? Are there any non-hormonal therapies that I can try? It's not necessary that you have to use HRT. There are other options, and women need to know what their options are before they make a decision. Make an informed decision by asking as many questions as possible. Risk factors, side effects are huge, and we don't always know what they are or understand before making a decision, and you can't paddle backwards.
Exactly.
So it's important to make sure that you just push on, push ahead, ask your doctor, risk factors, side effects, and what are my options, basically.
Okay.
Yeah.
And it's an option for women who have recovered from cancer as well.
People who have recovered, not just women who are going through menopause and they're not necessarily a cancer patient, but cancer patients tend to, a lot of the times, especially breast cancer patients, because their hormones, estrogen, i.e. estrogen, is going to be impacted. Typically, the results would be after treatment, they're put on HRT. So it really is a matter of, again, advocating for yourself and asking as many questions as possible. Is this safe? And what are the other options? Yeah.
Okay. So your advice, awareness, I mean, this is basically your role, but how do we normalize this conversation about around menopause and cancer, so that women don't feel isolated? Or
by this, by you doing what you're doing, we need more people to feel comfortable in their skin. There's no judgment, right? I mean, a lot of the times growing up, when you're a teenager, you feel socially awkward. And then when you reach a certain age, some women, even men, may say, you know what? I'm going to do me. I'm going to be true to myself. I know who I am. And sometimes we have to find that confidence. Not everyone has it. And sometimes we find it by tuning in to podcasts like this. Sometimes we find it by listening to another person's story. Storytelling is so critical in helping someone else through their journey. So the more people who tell their stories and share, the more they're going to inspire others to be comfortable in their skin and feeling like they're not alone. This is not a journey that is easy for so many people. Cancer diagnosis is one thing, but let's say there's no cancer diagnosis, just menopause, just perimenopause.
Okay.
That alone is a journey in itself. I mean, the stories I hear on a regular basis compared to the stories I heard when I was probably late teens, early 20s, because our parents didn't say, they may say, oh, I'm having a hot flash or a personal summer, but you didn't know what that meant necessarily. And now more and more people are sharing and telling. When you get with your girlfriends or your work colleagues, more people are sharing. More people are telling their story, and they're saying, you know, what works for them, what doesn't work, what feels bad, what doesn't, what feels good, what they've tried. You know, it's just a matter of sharing and storytelling and inspiring others and being comfortable in your own skin.
Okay.
Yeah.
Thank you. Thank you. And I think that also ties into the collaboration piece where you mentioned other organizations that are doing things and working with Bermuda Cancer and Health Center as well. But the more we know, the more informed decisions we can make and not feel so afraid to even talk about this conversation.
Exactly. And we, again, our presentations are free, and I can go out there and present all I want, walk up and down the street with my signs and, you know, getting the information out there. But I'm just one person. It takes a village. We are so many. We're a small island, but we're very big on supporting others. I feel we see it a lot at Relay for Life, which is, you know, a big cancer event that we host. It's our largest fundraiser, and the amount of networking and community and collaboration that we see with people saying, oh, I didn't know you were going through this. You know, neighbors coming together, strangers coming together, uniting in the fight against cancer. And I mean, I'm very privileged to work where I work and have the job that I have. And I am so thankful that I get to engage in the community, learn, I glean, I share, and I do my best to try to make a difference. And I hope that anyone tuned in can do their part to make a difference.
Thank you. Can we go back to lifestyle and prevention? You mentioned about nutrition. You touched on it briefly, but can we talk about nutrition and maintaining a healthy weight and just the overall impact on reducing cancer risk?
Well, it definitely can be a challenge for some of us, but it's important when we look at the foods we're eating. We really should be avoiding processed meats and processed foods. I think I mentioned that earlier. Think of the animals that are injected with so many hormones and chemicals, and then we're consuming that. Processed meats and red meats are definitely high on the chart for being causes of being diagnosed with cancer, different cancers. We should be eating more plant-based diet, more whole foods. So fruits and vegetables, we should be having at least 2.5 cups of fruits and veggies a day. Not really a lot, but fruits and vegetables are our best friend. I say this in every presentation because fruits and vegetables are loaded with the tiny powerhouses called antioxidants. And antioxidants are going to reduce our cancer risk because cancer thrives on the oxidization process. So the more fruits and vegetables you consume, the lower your risk. And really, we should be looking at organic produce. So many people say it's expensive, it's pricey. However, when you think of the non-organic produce, they are laden with pesticides and herbicides, and those cause cancer. There is a list of carcinogens, which are the things that cause cancer, on American Cancer Society's website, and they have a list of human carcinogens. And, you know, they are one of our global partners, American Cancer Society, and, you know, we pretty much are aligned and say the same thing: avoid processed and red meats. If you eat red meat, it should be grass-fed and organic. Those whole foods, fruits, vegetables, legumes, beans. Many people may say, well, I don't really have a taste for that. Well, folks, you need to broaden your palate, and it's really taking charge of your health. So when we're looking at menopause and we're looking at our cancer risk, it all aligns. So many diseases, whether it's cancer or anything else that's out there that is related to our lifestyle choices. We have to really take nutrition seriously. Alcohol is a biggie as well. How alcohol is contributes to so many cancers that are out there. People think alcohol, liver, but alcohol is related to breast cancer as well. Okay. So we really have to look at our alcohol consumption, reducing the consumption as much as possible, or just not drinking at all. No amount is safe, so it's better to leave it alone if you can. I know so many Bermudians tuned in will say, but it's part of our culture.
Yes.
But at the end of the day, we want a healthy culture. So looking at our nutrition and its impact on menopause and cancer risk, definitely looking at what you're consuming, leaving those processed foods, the fried foods, the sugary drinks, the colored foods with all the dyes. If the packages that you're picking up have more than 3 to 5 ingredients and you can't pronounce them, you probably shouldn't consume them. So and maintaining a healthy weight during menopause can be very challenging for women. If you have a lot of, if you have fat around the abdominal area, that increases your risk for breast cancer and other types of cancer. So it's important to really try to maintain a healthy weight by eating as clean and as healthy as possible.
Thank you. You made a comment about, in all of that, cancer thrives on oxidation.
Yes.
Can you explain that a little bit more, if you can?
So cancer, I mean, it's I don't want to get too technical and overwhelm folks. It's just we need to really think cancer cells live in our body, and we have things called epigenetics. It's not just genetics. There are things in the environment that we can consume that can turn those cells on or turn them off. And when we're looking at fruits and vegetables, particularly the ones that have loads of antioxidants, they just stop the process. Cancer, the more the cancer cells experience the oxidation process, the more they're going to thrive in your body. Think of like our metabolism. Metabolism is very tricky when it comes to menopause. So when we are looking at cancer cells thrive on calories. So the more calories you consume, the higher risk for cancer. And when we say calories, we mean the bad calories, like the processed foods, the fatty foods, the bad fatty foods. So the more cancer cells you have in I shouldn't say the more cancer cells you have in the body, but the more you are consuming those bad calories and the higher calories, cancer cells thrive on those calories. They have a very high metabolic rate. So the more bad calories you're consuming, which is why doctors, depending on your doctor, may suggest a low caloric diet to keep your weight down. And when we're thinking of oxidation and your metabolism, all of that stuff is connected because these are what cancer cells thrive on. And it's a process that's going on in your body. You don't realize it. And fruits and vegetables will help decrease your cancer risk the more you're consuming.
Before we wrap up, is there any messages anything else you want to share? Anything else that we may not have covered?
I mean, I feel like I covered so much. I probably said too much. I mean, it's never too much. I just feel it's the world of cancer. It can be a dark place for some people. Just know that there is support. Once you share and open your mouth and say you want support or you need help, that beacon of light is there. You just have to open your mouth and say, I need help. You may not know where to get help, but our center is there to guide you in the right direction. If we can't provide you with what you need, we will send you in the right direction. So we're here for the community. Folks can go to our website, cancer.bm. We have loads of information. Book a free presentation if you feel inspired and you want to share more information in a group setting. We're here to offer that. So we're here for the community.
Thank you. And you're absolutely right. Like this is a heavy conversation, a heavy topic. So I appreciate, you coming and sharing your knowledge and just being there for us. And again, to our viewers, this may have connected with them and they need to know they're not alone and they don't need to be afraid to ask for help. So
exactly.
Thank you. These are conversations that can feel heavy, but hearing them explained with compassion and education helps women feel empowered instead of afraid. To every woman listening, whether you are navigating perimenopause, concerned about your risks, or recovering from cancer, please remember this: your body deserves attention. Your symptoms deserve to be taken seriously, and early detection saves lives. You are not alone, and there is support available. If you'd like to connect with Bermuda Cancer and Health Center and learn more about screenings or access resources, all of Azuree's information will be listed in the episode description. And if you're ready to dive deeper into your own hormone health journey, you can connect with me through Azuree Wellness for coaching and personalized support. Thank you for joining us for this important episode of Beauty and the Wise. Don't forget to like, share, and subscribe on our YouTube channel or tune into Channel 82 and follow us on our social media channels. Until next time, take care of your body, protect your peace and your spirit.